believe I've met you before. Is this your first time coming to the clinic? Okay, that's no problem. So have you ever had what we call an ENT assessment before? No? Don't worry, I promise it's nothing to worry about. So, can I just take some of your basic details, just for our records? Okay, and I must apologise, our computer systems are down, so I'm having to do it the old-fashioned way with pen and paper. That's fine, okay? Okay, good. So could I just take your first name and your last name, please? Okay. Okay, and your date of birth? Oh, okay. Okay, and your address? Good. And the name of your GP who referred you? Dr. Lizzie. Okay. Okay, lovely. So, just to talk you through what this assessment entails. So basically, we're going to be having a really good check of your ears, nose and your throat. So I'm going to be touching you on all of these areas, just sort of feeling around for any areas where there might be pain, discomfort, sensitivity or swelling, and just let me know if you feel anything, and if you feel uncomfortable at any point, we can stop. Okay. Before we start, I've just got a few quick routine questions for you. So, are you on any current medication? No? Okay. Okay. Have you suffered any injuries to your face at all? So things like broken nose, or even if you've kind of hurt your neck, sort of twisted in any way. Okay, nothing like that? Okay. Right. How would you rate your hearing on a scale of 1 to 10? Is hearing not something that you have suffered, not something that you've struggled with? Okay, that's good. Right, okay, some more questions might pop up as we go through the assessment, but what I'm going to do now is pop some gloves on and we can get started. Okay, so it doesn't really matter what order we do this in, ears, nose and throat. I will say though that the ear portion does take longer than the other two parts, so it's up to you. What would you like to start with? Okay, we'll start with the ears, shall we? Yeah. Okay, so I've just got a pair of gloves here. I'm just going to put those on. This examination, it does involve a lot of touching, so I'll be keeping my gloves on throughout. So the very first thing I'm going to do is to have a look at the exterior part of your ears. So the actual ear, not the ear canal, but the actual outside of the ear. So this is going to involve the cartilage, the earlobe, the skin, all of that sort of thing, okay? And I'm going to use a flashlight and I'll be looking into your ear. I other side, okay? Perfect. Right, so we'll start over this side. Okay. Okay, just let me know if this hurts in any way, but what I'm gonna do is, with my gloves, I'm just going to touch around your ear. Okay? Yeah. How does that feel? Do you feel any discomfort? Any pain? No? That's good. That's good. Okay, so I'm just going to be applying some pressure onto your earlobe now. Can you feel that? Okay. Yeah, not too much pressure. I'm not going to be squeezing hard. You can feel it, yeah? That's great. I'm just going to move up now to the cartilage. Okay. So, just going to be having a little poke around, prod. Can you feel it? Okay, that's good. Right, so did you feel any kind of pain or discomfort? Good, good. No, from what I could tell, it all seemed perfectly fine and healthy. So basically what I'm looking for is any kind of broken skin or any indication that you might have broken bones or that the cartilage might be damaged in any way. But there was none of that, okay? So I'm going to go around the other side now and do the same again. Okay, so just going to be just touching around your ear. That's it. You can feel that. Just going to have a bit of a squeeze around your lobes. Can you feel that? And let me know if any part is a bit tender. Okay, that's fine. Good. Good. And the cartilage up the top. Okay. Alright, that's great. That's great. Alright, so what I'm going to do now is I have two objects, one of which I have a Q-tip and I have a hair grip. So what I'm going to do is just place them up against the skin of your ears, and I want you to tell me which one you think it is. So basically this is to test how well you are picking up on the different textures. So this one has, it's a very soft texture. This is not sharp. It does have a blunt edge, but it's a hard metal. So you should be able to distinguish between the two. Okay? Yeah. Okay. So we'll go over to this side. Alright? Feel that one up against your ear? Yeah, the hair grip, that's right. Okay, and now yep, that's the Q-tip. Perfect. Perfect. Okay, we'll go over to the other side. I've got both items still. Okay, so switching, so I tried to trick you there, but well done, you picked up on that. Okay, and again. Good, that was the hair grip. Perfect. Alright, so the sense of touch on your ear, the nerves in your ear, the skin on your ear, that all seems absolutely normal and fine. So now I need to take the light and I'm going to be looking deep in your ear, okay? So we'll do this on both sides. So if you could just hold still, this isn't going to be painful in any way. This is just me having a look. And I won't touch. If I need to get a deeper look, I may need to pull out your ear slightly, but I will let you know if I need to do that. Okay, good. Go back over this side. Okay, very good. Okay, I'm noticing quite a lot of earwax actually. Okay, do you often clean your ears? No? Okay. Let's just go round to the other side to have a look, okay? Right. Yeah, this one is the same. So quite a lot of earwax in there. Okay, so if you don't mind, what I would like to do is remove that for you. Okay, now even though I said there was quite a lot, it's not deep in, so this isn't going to be some complex extraction. I'm just going to use a Q-tip to go around. The wax that you have is quite shallow, so like I said, it doesn't go deep in. Have you been feeling kind of itchy or irritated in your ears? You haven't noticed? No, that's fine. Sometimes you can be a bit clogged up in your ears and you don't even notice, and other times it can make you feel down, it can make you feel poorly, it can make you feel dizzy, or you can get headaches. So you haven't had any of those symptoms? Okay, no worries, no worries. Is it okay with you if I go ahead and remove some of that earwax? Perfect, okay. I'm just going to use a Q-tip, alright? So, let's go over this side. Just got I'll probably use one for each ear, okay? That's good. Right. your hearing tested? Okay. Do you find that when you're speaking to people, you're having conversations, do you find that you are asking people to repeat themselves, or you're asking people to speak up? No? Okay. When you're watching TV, do you find that you're having to turn the volume up frequently? Okay, good. Do you listen to music with earbuds, earbuds in your ear? Headphones, that's the word I'm looking for. You do? Okay. How loud would you say that you put the volume? Okay. Alright then, so not too loud. Yeah, you should pass this with flying colours, okay? So, we'll just do a quick hearing test, okay? So, I'm going to whisper some words in your ears, and I'd just like you to repeat them back to me. And then we're going to do some sound tests as well about identifying different sounds, but we'll start with the whispers. Okay? Alright, okay, so we will start with the whisper test, and I'll just go over to this ear over here and just start whispering some very basic words, okay? And if you could just tell me what you think you can hear. Alright? Good. Clinic, 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 clinic. Yes, clinic, that's right. I thought that would be an apt word for us since we're in the clinic. Okay, I'll go over to the other ear and come up with something completely different, okay? Alright, something a bit more, something that you can't guess as easy, okay? Right. So, teacup, 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 teacup. Yes, that's right. It was teacup. Alright, so that's all fine. So that was really close up whispers in your ears. Now this time I'm gonna make some sounds. If you close your eyes, I can make some sounds around your head, and I want you to tell me where you think the sound is coming from. So the options are going to be over to the right, over to the left, or kind of in the middle. Alright, so I'll use my gloves to begin with to make the sounds. Alright, let's go. Alright, so just gonna hold my hands out to your ears, alright? Okay. Okay. was in the middle. Right, very, very well done. So, you can open your eyes now if you haven't already. That's very, very good. You can identify very clearly where the sounds are coming from. And I tried to mix up the pattern so that it wasn't too obvious. And you did fantastic. So, this is all normal. There's absolutely no concerns with your ears or your hearing other than the build-up of earwax, which we've removed now. But I would just advise to maybe a couple of times a week, just very gently go around your ears with a Q-tip. Yeah. Just make sure you don't dig it deep in your ears, just very gentle. And if you find that it's coming out kind of a dark brown colour, I would definitely book an appointment to come in and we can have it removed properly. It should be a very pale yellowy colour. Alright? Yes, try not to let it build up. Perfect. Right, so I'm just going to put different gloves on now. These are the gloves that I used to touch your ears, so I definitely don't want to be putting these gloves anywhere near your mouth. That wouldn't be very good. Okay, my hands can breathe again, so would you like me to check your nose or your throat and your mouth? Which one? Your nose. Okay, so basically what I'm going to do for your nose is I'm going to be having a feel along. I'm kind of checking your sinuses. I want to check the bone structure of your nose. I want to check if it's straight. And I will be looking very closely at the skin of your nose, as well as using a flashlight to look up your nostrils. Okay? Good. Right, I'll put some clean gloves on. Alright, so this is going to be a bit of touching your face, okay? Just a pre-warning. I hope you're comfortable with that. Okay. Good. Just kind of doing one side at a time. It helps me to kind of stay focused on each part. Yes. Okay, right. Just going to do it together now, both at the same time. Okay. Right. Good. Good. That's fine. Very good. Feels fine. Okay, can I just ask you to take a deep breath in and out through your nose. Like that. Okay, inhale. Good, good. And exhale. Perfect. Perfect. Okay, now if I hold on to one of your nostrils to keep it closed, can you take a deep breath just in the other one? Alright, we'll do this both sides. Okay, so I'm just going to hold on to your left nostril. Could you just take a deep breath through your right one? And then breathe out through your nose. Good, good. Alright, and now the other side. Take a deep breath. Good, good. And then fully through your nose. Perfect. Perfect. Very good. I know that most people exhale through their mouth when they're asked to do deep breathing, so it can go against the grain a little bit, but thank you for doing that. Okay, if you could just turn your head over to that side for me. I just want to have a check if your nose appears to be straight. Yeah, okay. Yeah, it does. That's fine. Okay, good. And if you could just look over to the other side. Any pain or tenderness? Okay, if I put quite a bit of pressure here, does that hurt? No? Okay. And on this side, if I put quite a bit of pressure, so I'm just pressing against the side of your nose. Any discomfort? No pain? Okay, perfect. Very good. And now up the top, along the space between your eyes, just poking around. Does that hurt? No? Okay. And then along the bridge of your nose. Does that hurt? Okay, good. So I don't think that any of the bones or the cartilage in your nose is damaged in any way. And you said that you haven't experienced any injuries to your nose. That's right? Good. Okay. So I'm just going to put the torch on and I'll be looking up your nose. So if you would mind putting your head back like that for me. Okay. So, yep, I'm just having a look up the right side first. Okay. Good. Yep, just hold still. That's fine. Okay. Do you often suffer with a blocked nose? No. Have you had a cold? Have you had a cold recently? No. Okay. Other side then. Alright. That's alright. That looks good. All clear. Perfect. So I have no concerns with your nose at all. Like I said, your nose is straight. You've got no kind of indications that the bones are broken, because most of the time you would know if you had a broken nose, but sometimes there could be micro breaks and you wouldn't necessarily know unless a doctor is specifically looking for it. Alright, and all inside your nose looked fine. It's clear. Okay. So the final part of the examination is your throat. So I'm just going to change the gloves again. Alright, so the final part of the test is your throat. So this is going to involve looking inside your mouth with a flashlight, as well as touching around your jaw, your lymph nodes, your neck, and your cheeks a bit as well. Okay, so we'll start off just by feeling. Better put my gloves on. Sorry about that. had any neck injuries? No, okay. Sore throat? When was the last time you had a sore throat? And on a scale of 1 to 10, how bad would you say it was? How much pain did it cause you when you last had a sore throat? Okay. So how long did it last for? Because I know that sore throats can be one of the most painful symptoms of a cold. Yeah. While we're on the topic, just to remind you that flu jabs are coming up soon as we move into winter, so don't forget to book yours in, okay? Good. Alright, feels fine on the outside, so if I can ask you to open your mouth wide and say ah as big as you can. I'm just gonna look down there. Don't worry about your tongue for now. Yeah. Alright, if you could poke your tongue out like this. And then open your mouth really wide again. Good. Alright. Now I'm gonna be using a teaspoon to push your tongue down so that I can get a clearer look at the back of your throat so that I can see your tonsils. Okay? Have you ever had tonsillitis? Okay, right. Have you ever had your tonsils removed? I know that some people, if you get tonsillitis quite frequently, sometimes you have your tonsillitis removed. You haven't had that? Okay. Alright then, if you could open your mouth and put your tongue out as wide as you can, I'll just be pressing it down. So basically I'm using the spoon as a tongue depressor. Well, personally I prefer to use a spoon because I don't really like the wooden sticks that they give us. You can get splinters off of those, so. Alright, tonsils look alright, that's fine. Good. Yep, that's okay. Just a bit wider. I know, I'm sorry. Just a bit wider for a second. Okay, that's fine. You can close your mouth now. Well done. Actually, if you just open your mouths again, I just want to have a look at the skin on the inside of your cheeks and also your gums. Okay, good. On the other side. No ulcers. Your gums are looking quite healthy. It does kind of look to me like you're a little bit sore on the inside of your cheeks. Do you sometimes chew it? I only ask because it can be sort of an anxiety related thing to chew the inside of your mouth. It's fine though, it doesn't look bad. It looks fine. Alright, and if you could lift your tongue up, just good look underneath your tongue. Okay. Alright then. There's one final part of this test, okay? I'm just going to ask you to swallow some saliva in your mouth, and I'm just going to feel. Yep, if you could just swallow then for me. Okay. Just kind of feeling your neck and feeling if it's a normal swallow reflex, okay? If you could do it again one more time. Good. Okay, good. So everything seems to be perfectly fine. I think the reason your GP referred you was probably because your ears needed a bit of a clean. But other than that, everything is perfectly healthy. I would just say, this is not my specialty, but just from looking inside your mouth, have you been to the dentist recently? I only ask because it does look like your teeth might need a bit of attention from a dentist. Alright, I mean, yeah, I'm not really an expert in that regard, but just from the little look that I had, it might be that you need a filling. Yeah. So we can put in a referral to the dentist for you, okay? Right, do you have any other concerns or questions relating to your ears, your hearing, your nose, or your mouth, your throat? No? Alright then, okay. I will get back to the GP and let them know that everything was fine and that you were all cleared, but I would advise that you check in again with us around the same time next year. Yes. Yeah, these things can change year to year, so it's always good to have regular check-ins. Okay, well, thank you for coming, and I hope you have a good day, and we'll see you again in about a year. Perfect. Goodbye now.